The ICU Medical Plum 360 is designed to deliver continuous intravenous therapy to patients. This video will describe the basic programming functions for primary and secondary lines when using this infusion pump. When you first turn on the Plum, it will run a self-check on its system. If it does not sense a cassette, it will prompt you to insert one before you can continue. Slide the primed cassette into place with the blue port facing up. Place the cassette's line in the tubing guide labeled A. This is always for your primary line's tubing. Close the cassette door by pushing the purple lever into its lowered position. The next screen will prompt you to choose a CCA, or Clinical Care Area. If your specialty is not listed, choose Adult. PO MedSurg and PO Critical Care stand for Pontiac, Oakland, and unless you are working at this facility, do not choose these CCAs. While you are choosing a CCA, the pump should be running a cassette test to make sure the cassette is primed correctly. If it does not find any issue, it will advance to the programming screen. However, if there are issues, it will alarm with a cassette test failure. Most likely this is due to air in the cassette. To clear this air, attach a syringe to the blue port on the cassette and push the leftmost soft key to back prime that line. This will push the contents of the cassette into the syringe. When the proximal tubing no longer has any visible air and the syringe is being filled only with fluid, you can release the back prime button and the pump will run another cassette test. If you have cleared all of the air, the pump will advance to the programming screen. To program the A line or primary line, push the soft key for A. You will be taken directly to the drug library. Here you will need to find the medication or fluid that you will be running through your pump. You can use the alphanumeric keypad to type up to the first 3 letters of your medication, and it will populate any entries that match those letters. For normal saline and a few other regular IV fluid mixtures, you will not find them listed individually, and you should choose IV fluid as your medication. The information you are required to enter will change based on the medication you are administering. For IV fluids, you can enter rate, volume to be infused or VTBI, or duration. You will only need to enter the volume to be infused and one other field. The pump will calculate the value for the third field. It is good practice to program the volume to be infused as less than the total volume in your bag. When the volume to be infused is finished, the pump is programmed to alarm and then restart at the previous rate. If you have a 1,000 milliliter bag of saline and the volume to be infused is set to 1,000, the pump will alarm when the bag is empty and then restart at the previous rate, let's say 100 milliliters an hour. The pump will then pull air from the empty bag, and when that air reaches the cassette, it will give a proximal air alarm. Now you will most likely need to prime a new tubing set when you replace the bag. However, if you program the pump with a volume to be infused of 900 milliliters, when it alarms with a completed volume to be infused, it will restart at a rate of 100 milliliters an hour, and there will still be an hour's worth of fluid in that bag. That gives the nurse ample time to get a new bag of medication and have it hung before therapy would ever be interrupted. If we search heparin in the drug library, we find that the necessary information we need to enter is completely different from IV fluids. For heparin, we first need to input a patient weight. Then we have the option of dose, rate, volume to be infused, and duration. Again, volume to be infused is necessary, and you should program for less than the total amount in the bag. If you enter dose or rate, the pump will calculate the other field, along with duration once you have the volume to be infused entered. With heparin, as you work through titrating the correct dose, it will be common that you will need to delay the medication for a period of time. One way of doing this that will save you from having to re-enter the entire program upon restart is to put the medication into standby. This is the leftmost soft key when you are on the programming screen. This will stop the medication, but keep the program stored on the pump to be restarted later. When it is time to restart the infusion, push the A soft key. It will ask if you want to restart, and then push yes. The Plum 360 is also able to infuse medications from a separate line through the same pump. To do this, attach the secondary or piggyback line to the blue port on the cassette. Remember to unclamp the roller clamp. Push the B soft key from the main screen. It will again take you directly to the drug library. Type in the first letters of the medication, and for this example we are using vancomycin. Choose the appropriate dose from the list. The new addition to the program screen is the mode selection. Vancomycin is programmed as piggyback, which means that the secondary line will run and the primary or A line will be paused. When the B line completes, the pump will automatically change back over to the A line program and resume the infusion. When the piggyback is started, the green light over the A program is constantly lit, but the B line light is flashing. This indicates that the A line is programmed, but not running. and the B line is currently running. When the B line is stopped, the B light remains lit, and the A light begins flashing, indicating that the B line has a program but is not currently running, but the A line is currently running its program. For our next example, we'll look at potassium chloride for a B line program. When infusing potassium, it is common to dilute the potassium with normal saline in an attempt to lessen the pain that is associated with a potassium infusion. If we program this medication as piggyback, it would stop the A-line saline from running while the potassium runs. But we want to dilute the potassium with the saline from the A-line. So to do this, change your mode from piggyback to concurrent. This will cause the pump to pump fluid from both the A and B lines simultaneously, mixing them in the IV line, and in this case, diluting the potassium for a less painful patient experience. When running a concurrent program, both the A and B lights will be flashing. This indicates that both lines are currently running their programs. The Plum 360 also has more advanced programming capabilities that will be explained in the next video of this series.